Alzheimer's disease affects millions of Americans, but new advances in treatment are offering some hope. And today we are taking a closer look at amyloid therapies, which is a promising new approach targeting one of the root causes of the disease. Joining us today is Dr. Barry Gordon, Regional Medical Director at Hartford Healthcare's Ayer Neuroscience Institute right in the central region. Thank you so much, Dr. Gordon, for being here.
Thanks for having me.
First of all, what are amyloid therapies for those who don't know, and how do they work to actually treat Alzheimer's disease?
Well, amyloid is a protein that precipitates out in the brain, and it is theorized to be the root cause of Alzheimer's disease. For many years, we've targeted trying to remove amyloid from the brain in order to treat the Alzheimer's disease. And for years and years and years, we couldn't get it quite right. And now it seems they do have it quite right. So the newest and latest treatment are anti-amyloid therapies. And what these therapies do is it's a manufactured antibody that tags the amyloid that's in the brain. And once the amyloid is tagged, then your normal immune system can clear it.
Wow.
So it's a new approach to treating Alzheimer's disease.
And who is a candidate for these anti-amyloid therapies, and how is that eligibility actually determined?
Yeah, so the goal is to treat early. And it's been that's the approach with all of the treatments for Alzheimer's disease. But with these therapies, it's very specific. We need people who are very mild, very early in the course of disease. So these are patients who may be diagnosed with Alzheimer's, but they may still be able to function in terms of a job, or they may be driving, or they may be able to manage some of their finances, but they definitely have Alzheimer's disease. So it's very early in the course. The other thing is these drugs are infused via intravenous. So these are patients that have to be able to be comfortable coming in every other week or every fourth week for an infusion. And these drugs require frequent MRIs. So if a patient is really uncomfortable in the MRI or severe claustrophobia or have any MRI contraindications, then they would not be a good candidate for these drugs.
Okay, good to know. And how is Hartford Healthcare uniquely supporting patients who are receiving these therapies?
Well, these therapies require a lot of resources. Hartford Healthcare is unique in that we have all of these resources within our system. And so when this treatment came up, we reached out to the different areas, nuclear medicine, MRI, pharmacy, infusion services. We brought together neurology, geriatrics, neuropsychiatry, social work. And most of this work is coming out of our memory care center down in Wethersfield. But we pulled all these people together to create a anti-amyloid therapy program so that we can create access for patients for this drug. The other thing is we have an amyloid therapy board. So this is a board of physicians and healthcare providers from different areas, and we review these cases. So if there's a provider who's not sure they have a patient who may be a candidate, they're maybe not a candidate for this drug, they can submit the case and we can review this case and help them to determine if their patient is a candidate, and if so, what are the risks, and hopefully provide access to these patients.
Okay, great information here. Thank you so much, Dr. Gordon. And if you would like some more information, you can always head to hartfordhealthcare.org/neuro.